That's right. We have a physical therapist here, Eric Passey, to talk a little bit about avoiding injuries. We're 3 weeks into the new year.
Correct.
And folks are exercising, but there are some things you can do to avoid being too sore or hurting yourself, right?
First of all, the first priority would be to set a goal.
Right.
So often we look at the new year and say, oh, I think I'll run a marathon. And that's not a realistic goal.
No, start small.
Start small and make a plan of how I'll do that. Where am I going to exercise? How am I going to
Maybe I'm going to
exercise?
work out for a week without getting hurt.
Correct.
Okay.
And maybe only 3 times a week, not every day.
All right.
To avoid that risk of injury, because I've gone from a sedentary lifestyle to an active lifestyle. So the risk of injury is much higher.
Well, a lot of folks might join a gym and do weights and use muscles that they really haven't used in a long time.
Correct. And so if I start slow, if I make a stepwise approach to this, and maybe if I go 1 day a week, if I've never worked out, maybe 1 day a week is plenty. Maybe I learn to walk a mile instead of run 3 miles, and so I can be consistent over time. Also using the right equipment.
Right.
So it's not a bad idea to invest in a pair of tennis shoes that haven't been worn out in the garden and around and are worn out.
Have a good cushion so you won't hurt yourself. Okay. And you also talked in the break a little bit about injury, and not necessarily injury, but the bad air.
Yes.
You can get hurt. You can get sick if you breathe in that bad air.
Exactly. So if I like to exercise outdoors, I need to have an alternate plan. So on these bad air days, I need to know, do I go to the gym? Do I do something at home? Do I go to a mall? Do I go to a fitness center that has an indoor opportunity?
Yes, and yes. Something other than being outside where it's horrible.
Correct.
Okay, and what if you do get hurt? I mean, what if you do push it a little too far and you're sore for a few days? Is that an injury?
Not necessarily. The first thing I would do is watch for a few days, 2 to 3 days. If it persists beyond longer than that, then I would seek attention from a therapist or a doctor.
You might have pulled something.
You might have pulled something. You could try some ice or heat or some over-the-counter anti-inflammatories, and then try to get active again. I wouldn't go back to hitting it hard, but I would start just gradually and get back into what you're doing.
So that's basically your advice, to set a goal and start slow. Baby steps and build up to it.
Correct.
Something more extreme.
And make rewards. So if you have a partner that you have accountability to, and then have a reward, so that the first little while, exercise is not going to feel good.
Right.
It takes a while for our body to get used to that.
Now you have a free seminar coming up at Alta View Hospital, and when is that?
Next Wednesday at
6:30
p.m.
Okay, next Wednesday at 6:30 at Alta View Hospital, and you can learn some quick tips to get back in shape without hurting yourself. Thank you, Eric Passey. Thanks so much. We'll be back in just a minute.